Hi there. Welcome back to Tuesday Talks Outside the Box with me, Lori Ramos Lemasters. Hey, I'm coming to you today to talk a little more about when your loved one has a hospital stay. The last time I came to you, I was actually at the hospital for a family emergency, and it occurred to me how important setting up a care team is, and I talked a good bit about that. But then on the 15th, I did a post on my Facebook page, Care Partners Resource and Consulting, and that post got a lot of traction. And it was talking about how it is so important to follow the doctor's instructions and how difficult that can be sometimes when your loved one is a little resistant to that. So I wanted to reiterate that a little bit today in Tuesday's talk because it can be sometimes so hard when your loved one is in pain or they don't want to get up out of bed, or the opposite could be true. They may be asking you to get them out of bed, but they may still have some tubes or some things connected that might, your nursing staff or your doctor may not want you doing that without their assistance. And that can be really difficult when you're stuck in the middle of what your loved one wants and what the physicians want. So understanding that is really hard, you have to remember that a little tough love sometimes in these situations is what's needed, and advocating for your loved one, but also advocating for yourself. So you're put in that situation rather than letting your loved one be upset with you and you doing something that the doctors don't really want. They don't want them getting out of bed yet, or they don't want them taking an additional medication like an ibuprofen or something that you might have that could conflict with their medical treatment. It's hard for us as the caregiver because we love our loved one, and we don't want to make them angry or upset when they're already in a difficult situation. So it's really important that you advocate both for them and for yourself. If you're being put in that position, it's okay to let the nurses know, gee, my husband's really upset with me, or my daughter wants me to do this for them, but I'm thinking that's not what you want. And let the nursing staff come in and take over. In some cases, they have a person who's called a patient sitter that perhaps could come in and be with your loved one while you go out and take a meal or have a good night's sleep. But they don't know that you need that unless you speak up and ask for it. So advocating for yourself is also very important. It's also important to remember that it's okay to advocate for your loved one in that situation. Doctors mean well and they do their best, as do nurses, but they don't always, there's not always the same nurse every day. They are human, let's just say that. And so it's important that you ask questions like, what is that medication? What is that medication for? How long do you anticipate him feeling like this? Or how long until my loved one can get out of bed and you expect them to walk? Or when they ask you to maybe take them for a walk, how long should I be taking them? How much is too much or not enough? All of those questions are very valid and important. So remember that when you're in those situations, you are the advocate and you are in control of those situations. And it is okay to take notes, to record meetings with the doctors or even the nurses. In fact, it's pretty important. And it's also much easier when another loved one comes in who maybe traveled in from out of town, or your children have been at work and then they come in, they want to know what the doctor had to say. You can just hand them the phone or recording device and let them listen to whatever those instructions were. But make sure that you advocate for yourself so that you're comfortable. Understand what the medications are. Understand what the therapy treatments are. Understand what the surgery might be or what it is for and what the anticipated recovery time is. And then when the time is right, ask those important questions about what you need to do when you get home. So anyway, those are my points for today, and I'm sending you lots of love and hoping that you are taking care of yourself. And until I talk to you again, please take really good care. And remember, check my YouTube page, and please subscribe if you have a moment, and my Facebook page, subscribe there also. And if you have any questions or any needs, I'm always available via email at lori@carepartnersresource.com. Take good care.